back for Module 3, Developing Occupation-Based Toolkits. The learning objectives for this module are to explore the significance of occupation-based toolkits and a value-driven practice, examine occupation-based toolkits and relevance to your practice setting, understand the importance of activity analysis during construction in the use of occupation-based toolkits, and consider implications for program development and resources needed in using occupation-based toolkits in your settings. So the process for the modular activities this week are the same as weeks 1 and 2. Participate in the discussion during week 1, post initial response by Friday of week 1, add 2 comments to your peers, and then review summary posts during week 2. This is just the modular timeline again. So, why use occupation-based practice? Studies have found that IADL interventions have moderate evidence that client-centered and task-specific occupational therapy interventions improve IADL performance in adults. Also, research has determined that older adults who were more physically active and involved in more productive roles had higher functioning and reduced levels of ADL and IADL dependence, as well as improved outcomes and improved performance. Occupation-based toolkits are a great method for promoting and implementing occupation-based practice within skilled nursing facilities. Some ideas that immediately come to mind when thinking of occupation-based toolkits are financial management, simple meal prep, letter writing, cards, sewing, scrapbooking, shadow boxes, art projects. However, there are many other ideas for occupation-based toolkits that you could easily create for your facility to meet the needs of the individual patients. The attached link is a link to occupation-based treatment kits for fieldwork projects. The ideas suggestions can also be applied to clinicians working in skilled nursing facilities. You may also want to check out the OT Toolkit. This website has several ideas for treatment regarding occupation-based interventions. However, when constructing occupation-based toolkits, it is important to consider the activity and occupational demands necessary for patients to successfully engage in the task at hand. Gender bias. So now that we've discussed a few ideas for occupation-based toolkits, do you think a gender bias occurs when we plan occupation-based interventions? Bias can be conscious or unconscious and may manifest in many ways, both subtle and obvious. Gender bias is also the exceptions due to attitudes based on the sex of an individual or group of individuals. So as you continue with this week's module, I want you to think about what are some things that we can engage our male population in that may be appropriate. So activity and occupational demands. Activity and occupational demands are the components of activities and occupations that occupational therapy practitioners consider during the clinical reasoning process. Depending on the context and needs of the client, these demands can be deemed barriers to or supports for participation. Specific knowledge about the demands of activities and occupations assist practitioners in selecting activities for therapeutic purposes. Demands of the activity or occupation include the relevance and importance to the client, objects used, their properties, space demands, social demands, sequencing and timing, required actions and performance skills, and required underlying body functions and body structures. Activity and occupational demands must be considered when planning, constructing, and implementing occupation-based practice in order to ensure that the client and the intervention is successful. This table outlines all components required when performing an activity analysis. Just some definitions. Client factors are specific capacities, characteristics, or beliefs that reside within the person and that influence performance in occupations. Performance skills are goal-directed actions that are observable as small units of engagement in daily occupations. They are learned and developed over time and situated in specific context and environments. Performance patterns are the habits, routines, roles, and rituals used used in the process of engaging in occupations or activities that can support or hinder occupational performance. Useful definitions are things to consider when planning your occupation-based toolkits. Client factors are affected by the presence or absence of illness, disease, deprivation, disability, and life experiences. In addition to the use of occupation-based interventions, therapists must be aware of individual patient needs. Activity analyses are often a good but can be a time-consuming way to determine if interventions are appropriate. I understand that there is no way possible to complete an activity analysis for each intervention for each patient, but it would be a possibility to complete a generic activity analysis for each occupation-based toolkit at your facility so that it can be used as a guide for occupation-based practice. This activity analysis is used at Cardinal Hill Rehabilitation Hospital in Lexington, Kentucky, and can be applied to any setting. Through the use of the activity analysis, therapists are better able to gain a more in-depth understanding of patient needs and better develop occupation-based interventions. This was an activity analysis that I completed with gardening. So, to describe the appropriate performance areas of occupation, we would be touching on IADLs, leisure, exploration, social participation, community, peer, friend interaction. What are the risks for performance of occupation? Performance skills would be routines, roles, and habits. Client factors may be mental, sensory, and neuromuscular. Okay, let's see. Mental would focus on attention, memory, perception. Sensory would focus on tactile, visual. Neuromuscular would focus on joint mobility and stability. So, for example, with this activity, you can address bilateral upper extremity range of motion, eye-hand coordination, fine motor coordination, object use, ability to scoop, pour, balance, and so on. For activity demands required for completion of gardening are tools, which would be seeds, flower pots, soil, utensils, gloves. Space demands, large space, tabletop, ground, depending if you're grading up or down. Social would be the ability to follow directions, converse with others. Sequencing, can they follow multiple steps needed to plant flowers and other directions. By completing an activity analysis and leaving it in an occupation-based toolkit, anyone who attempts to use the toolkit will have a better understanding of who is appropriate to participate and what is needed in order to complete the activity and how patients are benefiting from the intervention. Also, when completing activity analysis, I would suggest referencing the OT practice framework. Very beneficial. So, for this week's discussion board question, here's the supporting article, the abstract. Like I mentioned earlier, if you're a member of AOTA, you can go there and view the full article. And there's the other supporting article. So the discussion questions for this week are, what do you see as the value of having occupation-based toolkits readily available at your facility? Based upon your clients in your current setting or settings, list the top 3 types of occupation-based toolkits that you think would be useful and why, and describe the resources you would need to have available to support your needs in the construction of occupation-based toolkits. So this is just the module summary, concludes Module 3. Module 4 will be available on February 15th, and we're almost finished.